I think, what's actually happening is like this GLP-1 market is what it's being called, but it's actually like underselling what's actually happening. And that's not that, hey, this is a GLP phase or surge that we're going through.
Where do you think that the market is really headed from the next phase of where we are today?
So for decades, obesity is always treated as some version of like either eat less, exercise more, go see a nutrition, a dietitian, some sort of like surgeon, right? And then come back in 6 months and we'll reevaluate. And these people are just kind of left off there. You see this rise in dietary companies come up, like supplemental companies come up, but none of that really was, pharmacological, right? We weren't really like doing medicine stuff there, right? Lifestyle modifications, yes, is the most important piece to all this, but how does it pair into like real medicine? And I think that's what's happening right now. So now we have those pharmacological tools capable of producing some of those meaningful weight loss reductions, right, at scale. And that's something that we never had before. And that like really excites me, right? So now that's where everyone starts to think about what is obesity and how do we tackle obesity, right? So physicians, health systems, employers, insurers, entrepreneurs, patients, we're all thinking about it. And I think, what's actually happening is like this GLP-1 market is what it's being called, but it's actually like underselling what's actually happening. And that's not that, hey, this is a GLP phase or surge that we're going through. It's actually something much, much bigger. And we're in that middle of a new sort of birth of modern medicine, right? So that's why you're hearing all these like version 2, 3, 4.0s of medicine right now. But GLP was just like the starting point, right? It was the first product category that made a lot of this popular. But there's so many things in this space now to really look at that patient in like a true connected care sort of way, where we move away from, hey, sick care into true preventative care, which is, a much, much bigger topic. But that's, I think, where the industry is heading right now. It's so exciting.
Yeah, I mean, give me some insight there because, I think like when I first heard the word GLP-1, it was all this talk around semaglutide, and now it feels like everybody is migrated to tirzepatide. And then it feels like everybody is now migrating to retatrutide, right? And I've only experimented with tirzepatide and retatrutide. And I get my stuff. I happen to be in the industry. I have great contacts. I get blood work done. I go order from the people that I trust that get their pharmaceuticals from compound pharmacies that I trust, right? Because I want to get the good stuff. So, can you just break that down a little bit? Is if you could, is that because the drug is advancing? Is that because each drug does different things? Because obviously I've heard, and I have tried these, right? And I've had different side effects from all of them, some positive, some negative. But why do you see a like sema to TERS to now Reta from your standpoint?
Yeah, no, great question. And it is different, like how each medication reacts and behaves and what the actual intention of the medication is. Where a patient could have benefited greatly from semaglutide, it doesn't work for everybody the same way. And that's where, tirzepatide, as we saw that evolution into tirzepatide, which is a dual agonist, which is a GLP plus a GIP, which is different than semaglutide, where that's just a single agonist, a GLP-1 receptor only. And then retatrutide is like a triple agonist, right? So that's where like the GLP-1, GLP-2, GLP-3 comes in play, but it's not truly that. Like, that's not the right way to call it, even though a lot of people do, right? It's more of just like, on the street way of calling it. But these medications are continuing to evolve as we do have more studies coming out, and there are more things that we can target within the body, very similar to these receptors. So I think that's where this evolution is being. So after retatrutide, even again, which is undergoing right now a patent review as a biologic, and it's a whole thing in itself. And legal, if we get into more of the legal side of things, should not be compounded right now. It doesn't. I think we've heard a lot of this stuff with like compounding. The peptide market and everything that's been going on right in the last few weeks here. But with retatrutide, that's not even considered like a class 2 right now. It's not even officially released from, the big pharma yet. So that is a great medication. I think, the results right now have been just absolutely amazing. And I think we're going to see that more and more as these type of drugs do advance. But again, I'd be very cautious because you mentioned you're taking retatrutide. And hey, I did too, right? Initially, when I didn't know enough about this world, and I'm like, hey, the compounding pharmacy is great, right? You can get whatever that comes from there is safe for me. It's coming from a pharmacy, right? I mean, then you get to really learn, like, oh no, that's not the case. But it is, yeah, I like that your approach is, let's talk to the pharmacy directly before I actually get these medications. And that also, I guess we'll tie into a little bit later about like what we do and wherever you get this source from. It's very important that they're vetting these pharmacies so you get the best product.